folks, Renee Coover coming to you today from the American Med Spa Association with some breaking news for our North Dakota AmSpa members. We recently got word from the North Dakota Board of Nursing that they have clarified a law in the state relating to the scope of practice for registered nurses. We received questions from members recently, and some people were concerned or confused about the clarifications that were made by the Board of Nursing. So we wanted to be sure that all of our members are up to date for the new North Dakota clarifications. According to the Board of Nursing in North Dakota, over the past 6 to 8 months, they had received several public concerns and complaints related to nurses in the medical spa setting who were administering Botox and fillers without any type of physician involvement or oversight. So the Board of Nursing began exploring and investigating this issue, and they reached out to the state nursing boards and 16 other states for some direction on this issue. They reviewed several position statements in these other states in order to come up with their own opinion on how to clarify the law in their state. So after conducting all of this research and review, the Board of Nursing in North Dakota determined that it was necessary to clarify the law when it comes to what is and is not allowed for RNs to do in the state, particularly in the med spa setting. So according to the North Dakota law, the rules and educational training and nursing programs, the Board of Nursing has clarified that it is within the scope of practice for an RN to inject prescribed medications like Botox as part of a medical treatment plan for patients. However, it is not within an RN's scope of practice to actually prescribe or dispense medications or medically diagnose or determine a medical treatment for a patient. So the important distinction here is that although the RN could take a patient history and do a patient assessment before that patient gets Botox or some other filler treatment, before that patient can get treatment, the RN needs the consult or examination phase to be done by a prescriber, which in most states, including North Dakota, is going to be either a physician assistant, or a certified nurse practitioner. So the RN themselves cannot actually do a first-time patient consult or examination. That needs to be done by an authorized prescriber. And then once that consult or examination is complete, the RN now has the ability to actually inject Botox and other fillers. That medical treatment plan has to include that initial assessment and evaluation by the prescriber in order to comply with North Dakota laws. So this is a clarification in the law, and we wanted to make sure that all of our North Dakota members are aware of it. If you have any other questions, you can always hit us up at AmSpa. Thank you so much. Take care.